Welcome to this video. Before we begin, it is important to clarify the purpose and scope of the information presented here. This content is intended solely for educational purposes and is not a substitute for professional medical or psychological care. If you have concerns about your mental health, relationships, or interactions with others, please consult a qualified healthcare provider who can offer guidance tailored to your specific situation. In this video, we will discuss the topic of narcissism in general terms. The discussion is informative and educational and does not refer to any specific individual. This means that the content should not be used to make claims or accusations about anyone you know or encounter. Labeling someone as a narcissist without proper evaluation is inaccurate and can be harmful. Additionally, permission is not granted to repost or share this video in a way that implies endorsement of claims against any specific person. Misusing this content in such a manner constitutes unauthorized use. Our goal is to provide viewers with a better understanding of narcissistic traits and behaviors, how they can affect relationships, and strategies for recognizing patterns for educational purposes. By keeping this in mind, you can approach the material with clarity, respect, and responsibility. Narcissism is a personality trait characterized by an inflated sense of self-importance, a deep need for admiration, and a lack of empathy for others. While everyone may show narcissistic tendencies occasionally, narcissism becomes a concern when these traits are persistent, pervasive, and negatively affect relationships or daily life. Narcissistic personality disorder versus narcissistic traits. It is important to distinguish between narcissistic personality disorder, NPD, and general narcissistic behaviors. NPD is a diagnosed mental health condition, evaluated by trained professionals, and follows specific clinical criteria. On the other hand, someone may display narcissistic traits without meeting the threshold for a clinical diagnosis. Understanding this difference prevents mislabeling and misjudging others. Common misconceptions about narcissism. Many people assume narcissism is limited to arrogance or self-centeredness, but it is much more complex. Narcissistic behaviors can include manipulation, emotional exploitation, attention-seeking, or even charm and charisma. Recognizing these patterns is crucial for understanding the dynamics of interpersonal relationships and protecting oneself from potential harm. Grandiosity and self-importance. One of the most recognizable traits of narcissism is an exaggerated sense of self-importance. Individuals with narcissistic tendencies often believe they are superior to others, expect special treatment, and may exaggerate their achievements. This grandiosity can appear confident and charming at first, but it can also be intimidating or dismissive to those around them. Need for admiration. Narcissistic individuals often seek constant validation and recognition. This is not limited to praise for achievements. They may also seek attention through status, appearance, or social influence. When this need is not met, they may become frustrated, defensive, or resentful. Recognizing this pattern can help you understand their behavior without internalizing it. Lack of empathy. A defining feature of narcissism is difficulty understanding or caring about others' feelings. This lack of empathy can manifest as insensitivity, dismissiveness, or emotional exploitation. People interacting with narcissists may feel unheard, undervalued, or manipulated, which can create strain in personal and professional relationships. Manipulation and control. Some narcissistic behaviors involve subtle manipulation to maintain control or superiority. This can include guilt-tripping, gaslighting, or exaggerating narratives to influence others. Awareness of these behaviors allows individuals to set boundaries and protect their emotional well-being. Charm and superficial relationships. Interestingly, narcissists can appear charming, engaging, and socially adept, which can make early interactions enjoyable or flattering. However, relationships may later feel one-sided, transactional, or emotionally draining as their primary focus remains on themselves. Emotional strain and confusion. One of the most significant effects of interacting with a narcissist is emotional strain. People often feel confused, frustrated, or insecure, as narcissists may shift between charm and criticism unpredictably. This inconsistency can make it difficult to understand their true intentions, leaving others feeling unstable or doubting themselves. Erosion of self-esteem. Narcissistic behaviors such as criticism, gaslighting, or dismissiveness can slowly erode a person's self-esteem. Over time, individuals may begin to second-guess their perceptions, over-apologize, or adapt excessively to avoid conflict. Recognizing this pattern is crucial to maintaining personal boundaries and protecting one's sense of self-worth. Manipulation and control dynamics. In relationships, narcissists may engage in emotional manipulation to maintain influence or control. This can include playing on guilt, exaggerating achievements, or undermining confidence. Understanding these tactics helps individuals identify unhealthy dynamics early and respond strategically rather than emotionally. Challenges in communication. Communication with narcissists can be difficult and one-sided. They may dismiss concerns, deflect responsibility, or focus conversations solely on themselves. This can create frustration and misunderstandings, making it essential to set clear expectations and establish healthy communication boundaries. Impact on intimate relationships. In intimate or long-term relationships, narcissistic behaviors can lead to emotional exhaustion, disconnection, and recurring conflict. Partners may feel unappreciated or neglected, which can affect emotional intimacy and overall relationship satisfaction. Recognizing these signs early can prevent prolonged emotional harm. Recognize and accept the behavior. The first step in protecting yourself is awareness. Recognize the patterns of narcissistic behavior, manipulation, lack of empathy, or attention-seeking, without trying to justify or excuse them. Accepting that these behaviors are not your fault allows you to approach the situation objectively rather than emotionally. Set clear boundaries. Establishing firm, respectful boundaries is essential. Clearly communicate what behaviors are unacceptable and be consistent in enforcing them. Boundaries can include limiting contact, refusing to engage in manipulative conversations, or prioritizing your own emotional needs. Consistency reinforces your personal limits and reduces the potential for emotional exploitation. Protect your emotional well-being. Engaging with narcissistic individuals can be emotionally draining. It is important to prioritize self-care by seeking support from friends, family, or mental health professionals. Activities that foster self-esteem, relaxation, and resilience can help you maintain stability while navigating challenging interactions. Maintain realistic expectations. Understand that a narcissist's behavior is unlikely to change quickly. Managing expectations allows you to focus on your own well-being rather than attempting to alter or fix the individual. Accepting limitations in the relationship can reduce frustration and emotional strain. Seek professional support if needed. If interactions with a narcissist significantly impact your life, consider consulting a therapist or counselor. Professionals can provide strategies for effective communication, boundary setting, and emotional recovery, helping you navigate relationships safely and constructively. Spotting manipulative behaviors. Narcissistic patterns often appear in subtle ways. Individuals may use guilt, exaggeration, or selective honesty to influence others. Pay attention to behaviors that consistently leave you feeling confused, pressured, or undervalued. Recognizing these patterns early allows you to respond thoughtfully rather than react impulsively. Identifying attention-seeking actions. Many narcissists thrive on attention and admiration. This can include dominating conversations, seeking praise for minor accomplishments, or exaggerating personal stories. Observing these tendencies helps you understand when interactions are more about them than the relationship or task at hand. Detecting a lack of empathy. A consistent lack of empathy is a strong indicator of narcissistic behavior. Notice if the person minimizes your feelings, interrupts your concerns, or avoids emotional responsibility. Awareness of this pattern can prevent emotional burnout and protect your self-esteem. Recognizing cycles of charm and criticism. Narcissists often alternate between being charming and critical. This cycle can create dependency, where you constantly seek approval while experiencing occasional negative feedback. Recognizing this dynamic allows you to maintain emotional balance and avoid being manipulated. Evaluating relationship health. Consider the overall balance and mutual respect in the relationship. If interactions consistently leave you feeling drained, anxious, or unappreciated, it may indicate narcissistic influence. Awareness allows you to set appropriate boundaries and make informed decisions about your engagement. Stay calm and composed. When interacting with narcissistic individuals, it is essential to remain calm and composed. Avoid reacting emotionally to provocations, as narcissists often thrive on conflict and attention. Practicing mindful responses rather than impulsive reactions can help maintain control of the situation and protect your emotional state. Use clear and direct communication. Communicate your needs and boundaries clearly and directly. Avoid vague language that can be misinterpreted. For example, instead of saying, "I wish you would listen more," say, "I need you to let me finish speaking before responding." Clear communication reduces opportunities for manipulation or misrepresentation. Limit engagement in arguments. Narcissists may attempt to draw you into unproductive arguments or emotional debates. Recognize when a conversation is unhealthy or circular and disengage politely but firmly. This strategy prevents escalation and preserves your mental energy. Set and maintain boundaries. Boundaries are critical when interacting with narcissists. Decide what behavior is acceptable and consistently enforce limits. This may include restricting contact, refusing to engage in manipulative discussions, or prioritizing your own schedule and needs. Boundaries demonstrate self-respect and reduce vulnerability to manipulation. Focus on self-care and support. Networks maintaining your well-being is vital. Engage in self-care practices such as journaling, exercising, or spending time with supportive friends and family. Consulting a mental health professional can provide guidance on coping strategies and emotional resilience. Strong support networks reinforce your confidence and perspective, helping you interact with narcissists more safely and effectively. In this video, we explored the topic of narcissism, its traits, behaviors, and impact on relationships. We discussed how narcissistic tendencies can range from self-centeredness and a need for admiration to more complex behaviors such as manipulation, emotional exploitation, and cycles of charm and criticism. Understanding these patterns is essential for protecting your emotional well-being and maintaining healthy interactions. We also covered practical strategies for dealing with narcissistic individuals. These include recognizing and accepting the behavior, setting clear boundaries, using calm and direct communication, and prioritizing self-care. Maintaining awareness and realistic expectations can reduce emotional strain and help you navigate relationships with clarity and confidence. Remember, this information is intended for educational purposes only. It is not a substitute for professional guidance or therapy. If you feel affected by narcissistic interactions, consider seeking support from qualified mental health professionals who can provide personalized strategies. By staying informed, setting boundaries, and fostering self-awareness, you can protect yourself from emotional harm while gaining a better understanding of interpersonal dynamics. The knowledge shared here empowers you to interact thoughtfully, maintain your mental health, and approach relationships with clarity and confidence.